Welcome back, guys. This video will going to be the last video from E.coli lecture series. So in this video we will going to talk about the treatment and control of the E.coli disease. So let's get started. So first of all, the treatment is totally based on the symptomatology. What is the meaning of this symptomatology? Symptomatology meaning that we are doing the treatment on the basis of the symptoms, because if we are observing watery diarrhea, so it is clear that we are fighting against it EC. If we are observing bloody diarrhea, then EHEC. If our patient is a children and observing diarrhea, then we can conclude that it is a cause of EPEC, right? So it is important that treatment is highly based on symptomatology. The most important treatment is obviously fluid replacement, although it is a bacterial infection, but we usually not preferring antibiotic. But when the condition is severe or when the disease is progressed to systematic stage, then we should use antibiotic. And what is the reason behind that? Because they have the ability to develop drug resistance. That is why we have to use antibiotic with a very good precaution, and when we will use antibiotic only when it is highly required. So E. coli may be sensitive to many drugs such as chloramphenicol, chlorotetracycline, neomycin, nitrofuran, gentamicin, methylprim sulfadimethoxin, nalidixic acid, oxytetracycline, polymyxin B, spectinomycin, streptomycin, and sulfur drugs. So drug resistance is the most important concern, and it becoming in prevalent day by day, and it is essential to do susceptibility testing. We have discussed about the susceptibility testing during the staphylococcal aureus treatment video, where we have talked about that how susceptibility testing allow us to find out which drug should be best for the treatment of that particular disease. We are not performing any kind of treatment in case of EHEC infection, because it can increase the release of Shiga-like toxin and also have the ability to trigger the hemolytic uremic syndrome. And not only that, if we will use antibiotics against EHEC, they have the ability to develop drug resistance. And we all know that among all type of E. coli strains we have discussed until now, EHEC is causing the most deadliest symptoms, right? So by chancely, if the bacteria develop antibiotic resistance against EHEC, so it becomes very dangerous for the mankind. That is why usually we are not recommending any kind of treatment for EHEC. If very important, then we should do fluid replacement or any kind of electrolyte replacement intravenously. But most of the cases we are just increasing our immunity so that our body's own immune system can fight against those bacteria. Okay, so now as they have the ability to create drug resistance, that is why both first line and second line antibiotics are available for the treatment. So first line antibiotics are nitrofurantoin, nalidixic acid, norfloxacin, ampicillin, cotrimoxazole, and second line injectables are ciprofloxacin, ceftriaxone, cefuroxime, gentamicin. So second line injectables are mostly used when bacteria have developed drug resistance to first line drugs. Okay. Now let's talk about the control of E. coli. So it can be controlled by preventing transmission and by tracing the importance of breastfeeding of infants. Transmission can be prevented by maintaining a good hygiene. The best treatment is oral fluid, I have told you, and electrolyte replacement. Okay, so antibiotics are not recommended because it have the ability to develop drug resistance. Vaccines are luckily available. Commercially available killed vaccine containing pathogenic E. coli and autologous killed vaccine are also available, and purified E. coli K19 fembrile or whole cell preparation along with rotavirus in pregnant cows. they are also important. Okay, so that is the last video for the E. coli, where we have talked about the treatment, control, and vaccinations. So I hope this information should be helpful to you, and thank you for listening to this class.